E-cigarettes is probably one of the greatest controversies in public health today. It certainly feels like it if you sit where I sit. And so building an evidence-based consensus was never going to be easy. Fortunately, a lot of work had already been undertaken before PHE even was founded. And I suppose of particular note was the 2007 Royal College of Physicians groundbreaking report, followed in 2008 by ASH's publication that led the ASH-led coalition of over 100 health groups signing up to their report Beyond Smoking Kills, with clear recommendations for tobacco harm reduction. Obviously, other things have taken place, including the NICE harm reduction guidance in 2013. So a lot was going on before Public Health England joined the debate. So we came to the party late when we were established in April 13. PHE at its inception was genuinely uncertain about the role of e-cigarettes, and Professor Eugene Milne, who was then in charge of our tobacco team, commissioned the first of 2 evidence reviews. There were those within Public Health England who started off as sceptics and others who were more optimistic about e-cigarettes. So the evidence reviews that we commissioned were crucial in helping us come to a common stance within the organisation. So we had to get our act together before we could begin to engage with others. And we embarked upon a series of gatherings as a first stage in getting a common stance agreed to enable us to develop a PHE opinion, which involved getting our own opinion formers internally round the table for a discussion. The next step was to get some degree of consensus with other public health bodies, if only agreeing what we could agree on and what we couldn't agree, and what we disagreed on. But obviously, as opinion was beginning to shift from the beginning of 2013 inside Public Health England, so it was doing much the same elsewhere in our partner organisations. So it was about this time that Public Health England was reaching a point that many of our tobacco control partners had already reached on their own. So we were playing catch-up to a degree. And some of the principles that emerged from those discussions with internal groupings, with our Public Health Contact Group, and with the Public Health England's Tobacco Control Implementation Board, emerged and may actually have seemed pretty obvious to people in this room at the time, but in some quarters, 2 years ago, they were seen as fairly controversial, and I think to some people even somewhat subversive. So moving on, we held our first e-cigarette symposium in 2014, and that's the point at which I assumed responsibility for this agenda in Public Health England. So it was fascinating for me to have been at that symposium and to have seen the range of view articulated as strongly as it was by various factions in the room. And obviously, up to that point, we had been engaging with professionals, mostly public health professionals, about this topic. So for our e-cigarette symposium, we started to include Vapers in the conversation, not least because they bring an expertise that we cannot get anywhere else. And as many of you who were in the room today will remember, that was obviously quite an interesting step, and one that some people taking part in the symposium found quite tricky to get their head round. But it was an extremely useful day, and it put the wind in our sails and really got us going on this topic. And I think I'd just like to, reiterate that how useful it is always to have people who are the users of what everyone is talking about in the room when you're talking about it. I come from the drugs and alcohol world, and we wouldn't dream of having conversations without taking the views of people who are the actual users of what we're discussing. So, we moved on to a public conversation about e-cigarette use in enclosed public places. And the first stage of that conversation was open to members of the Faculty of Public Health and the Association of Public Health, and subsequently open to a wider set of stakeholders. What made this conversation unique was that we went out of our way to commission commentaries and critiques of our position. We actively pursued individuals to take part in the discussion. We wanted a wide range of views and actively attempted to engage those who had been loudest amongst our critics. Those right over there on that end of the spectrum declined to take part, which I think was a pity. Because it's all very well to criticise on the sidelines, but it would have been better to have actually taken part in that exercise and made those views clear to everybody. So that was a innovative process that helped us in developing 5 draft principles to distinguish vaping from smoking, protect bystanders in line with the evidence, protect children and young people, support smokers to stop, and support compliance with smoke-free laws and policies. Over 3/4 of respondents agree with the proposition that a legal ban on vaping indoors would not be justified on the grounds of risk to the health of bystanders from passive exposure. And over 4/5 of respondents agreed to support smokers to stop, it should be easier to vape than to smoke. And 3/4 of respondents agreed that while policies should guard against encouraging youth take-up, nicotine vaporizers can help reduce exposure of children and young people to second-hand smoke and to smoking role models. Very useful consensus, as you can see, very significant figures of the respondents agreeing with the propositions that we put forward. We have since then been really pleased to have established with Cancer Research UK the UK e-cigarette research forum to explore emerging issues in e-cigarette research that I think is probably fundamental to us being able to carry on having a useful and informed conversation. In 2005, earlier this year, we commissioned a review of the up-to-date evidence around e-cigarettes. It was a ministerial commission to us at the beginning of the year. We were pleased to have Anne McNeil, who's been with you today, and Peter Hayek as the lead authors on that. And it produced for us an absolutely sound foundation for policy and practice going forward. It's been widely supported by organisational stakeholders, criticised in some quarters, very noisy criticism in some limited quarters, but it did usefully provide the catalyst for a joint statement from Public Health England with a range of other public health partners, which was seen as a useful step forward at the time. So our next steps, the things that we have in train for our in our work programme for this coming year, for this current year that we're in, and it will take us obviously into next year, is the publication of framework advice on vaping in public places, a collaborative advice we're developing on vaping in the home. We're hosting a second e-cigarette symposium next year, which obviously will be really interesting because it will be 2 years on from the last one. There's been quite a significant shift in thinking, and I'm sure it will be lively with some controversy, but it will be against a very different backdrop than the first one we held, because it will be against the backdrop of our e-cigarette publication this year. We're working, we've commissioned guidance from the NCSCT on e-cigarettes in stop smoking services. I think that's a very significant step. Obviously, lots and lots of people have turned to e-cigarettes to help them stop smoking, and we need to make sure that those people that are looking to quit get the very best from the advice and support from stop smoking services, along with their preferred route of using e-cigarettes to help them do that. And we have another role in supporting local policy making on e-cigarettes and local stop smoking services. So we work through the Public Health England centres across England, the 9 centres, and help staff who are interfacing with local authorities and with local NHS services. And we have also a role in supporting no smoking policies in prisons as well, which is a really interesting area, I think, particularly with regard to our role of closing the gap in inequalities across the country. That is a specifically brave step forward, I think. So I just wanted to pose a couple of questions for you to either think about today or to take away with you. And these are of interest to us. They're the sort of things that we kick around amongst ourselves. Is an evidence-based consensus possible, or is evidence making intrinsically difficult? Do we always have to have these what appear on some occasions pretty polarised discussions before we can get to a policy position? And how do we overcome the confirmation bias in ourselves in particular, as we are guiding some of this along, and in others? And how can we make sure that emerging consensus remains responsive to a changing evidence base? I think it's really interesting that we mustn't find ourselves so comfortable with what we think the evidence is telling us and what we understand of the evidence that we can't open our eyes to emerging issues, and that we dismiss them without properly taking note. And I think for us in Public Health England, having got to such a useful place with regard to e-cigarettes as a result of the evidence review that we published this year, we must remain open to informed challenge and take note of emerging evidence. So that's my piece for now, Anne. Thank you very much. Sorry?
We'll just take one question, if anybody's got a question in the audience. Yeah, saw the hand there.
Yeah. Hi. Thank you for your address.
Name and...
Farrell Dillman, TMA in the USA. We've noticed in the UK and in the US both that the historic rates of decline in cigarette consumption appear to be reversing themselves, and that we're seeing a kind of plateau, or in the US, we're actually seeing an increase in the first half of this year. Are you feeling any special urgency because of that in the work that you're doing at PHE, that perhaps public health is coming to the table a bit late, given the results in your report recently?
Right. Is public health coming to the table a bit late? I'm not sure about that. I pride myself actually in not being a public health professional. And I don't think public health would see itself as coming late to the table. I think tobacco cessation has been a hugely important area of work for public health professionals. I think we're seeing a plateauing in cigarette use. But we organisationally have an ambition of a smoke-free generation by 2025. And that's something that all our work, including our e-cigarette work, is harnessed towards. So that's a very significant ambition. And I think, as in lots of these tricky areas, we will have the behaviour of people who find it most easy to change and have the general wherewithal to be able to choose to change will have done so. So we will have this population who are still smoking, who I would hazard a guess are going to be maybe more difficult to help to choose other options. So the e-cigarette work is just part and parcel of our general quest for a smoke-free generation. And I think a challenge is good for us all. We wouldn't want to be sitting here being complacent and thinking we'd got the job half done. I think it's always good for all of us to be up against it.